Welcome, everybody. Good morning. Thank you for coming. It's nice to see everybody. I'm Allison McCann with the University of Rhode Island College of Environment and Life Sciences, and along with my colleague Laurel Shader from Silent Spring Institute, we are co-leading the Community Engagement Corps for the STEEP project. And thank you for coming to our first annual STEEP Science Day here in Barnstable Town Hall. And if you haven't noticed, the STEEP team is in blue t-shirts, and that's intentional so that you can pick us out and be able to interact, ask questions, wondering where the bathroom is or what the most important salient point of their most recent research project may be. So, so please don't hesitate to interact with us and to engage with us throughout the day. On behalf of the STEEP team, we want to thank you for coming and welcome you for being here today. Our topic is an important one, as you all know, as residents of Cape Cod, and will become clear as we move through our day today and have our conversations. It's not a week has gone by recently where PFASs have not been in the news locally, regionally, and nationally. So we know that it's an important topic, and we know that on Cape Cod, perhaps you're feeling it's about time, because you've been living with this for quite a number of years. We see today as an opportunity to ask, learn, and act. To ask questions, to voice your concerns, to make comments about the work that we're doing, about what's happening here on Cape Cod, to learn about new research findings, project directions, and discover new ways of addressing the topic of PFASs in the environment. And to act, to continue your involvement, your important involvement with ongoing activities. We'll talk about our private well testing study that is being kicked off and how private well owners on the Cape may choose to volunteer and get engaged in that project. So ask, learn, and act. That's our mantra for today. STEEP is a URI-led Superfund research project. It's funded by the National Institute of Health's National Institute of Environmental Health Sciences. It's a mouthful. It's a Superfund research project. It's a 5-year project in partnership with URI, Harvard University, Silent Spring Institutes, and our community partners also. We have what we hope is an interactive, informative, and engaging day of activities. I'll just throw the agenda up here about where we're headed today. You know, they don't call it super fun for nothing. Sorry about the pun, but I couldn't resist. But here's where we're headed today, and we invite you to be able to stay for the day, stay for the morning with the film that we're about to show. If you need to leave and come back, that's fine. So it's really kind of a free-flowing day. But here is where we're headed. We're going to start this morning with a film, and Laurel's going to talk about that in just a minute. Around 11:30, a film and a discussion with our colleague Philippe Grandjean from Harvard University. At 11:30, we'll have some light refreshments and some mingling. Our STEEP trainees have brought posters. They're along the back. And I encourage you to interact with our trainees, talk with them about their work, their interesting findings, where they're going with their work, and learn more about what they're doing. We'll have some STEEP project updates at 12:30, a little break, and then we have some concurrent activities this afternoon. We'll have a discussion in the boardroom just across the hall here entitled What's on Your Mind? It's a discussion with the Research Translation Corps, talking about what are some of the community needs for research translation and information on Cape Cod. We'll have dedicated time for a spotlight on STEEP's future scientists for folks to interact with the STEEP trainees and look at their posters. And then also, we're delighted to be able to host a tour of the Hyannis Water System. The Hyannis Water System is hosting that tour, and Hans Kaiser, the supervisor, will be providing that tour this afternoon, and that will be off-site. More about that in a little bit. So with that, thank you for coming, and I'll turn it over to Laurel.
Thanks, Allison. Thanks to all of you for coming. It's really a pleasure to be here today and to have the whole STEEP team here. We've got a great day of activities lined up. So our first event this morning is going to be a film. It's called The Islands and the Whales. And it's set in the Faroe Islands, which are in the North Atlantic. And I'm really pleased that Philippe Grandjean is here. He's one of the researchers. He's the co-director of the STEEP Center, and he's leading some of STEEP's research on health effects of these highly fluorinated chemicals, PFASs, in children in the Faroe Islands. Dr. Grandjean has worked in the Faroe Islands for many years and has done really seminal work in understanding health effects of mercury and PCBs and other pollutants as well. So I will invite him to talk for a few minutes about the film and his involvement in the Faroe Islands, and then we'll show the film. It will run for about an hour, and then afterwards we'll have some time for you to ask Dr. Grandjean questions. So Philippe, could we have you come up?
Thank you both. I actually just returned from the Faroes, where I met with Mike Day, the filmmaker. Mike is a Scot, and his family really wanted him to be a lawyer, and he got his law degree, and then he finally decided, I'm not going to use that law degree. I want to be a filmmaker. I want to make documentaries about people who are exposed to environmental hazards and how those affect their lives and their culture, their societies. So he generated this movie on the Faroes, and you'll soon understand why he went to the Faroes. I've communicated with Mike over several years. It took him 5 years to make this film, and provided advice to the extent I could. But I'm not in the film. My colleague Paul Weihe, who's the physician, he was the director of the hospital system up there for several years. He features prominently in the film. I asked him if he could come over here for this meeting, but he had some conflict. He couldn't travel, and Mike is right now filming in Greenland, so we couldn't arrange it, but at least we got the copy of the film, and the cut we're going to show you today is the one that was actually done with public television. It has been shown once on public television, and of course it has been shown on some documentary events, and it has won some awards, and you'll soon understand why it won awards. I myself have seen it several times, and I discover new details every time I see it. I absolutely adore it. So what we're going to do now is to show the film, and afterwards we will, if you have questions, I'll be happy to answer to the extent I can, and otherwise perhaps we can debate the Faroese situation, where they're exposed to mercury. You'll hear about mercury, but also PFAS is the same compounds you have in your drinking water. They get it from the food, from the marine pollution. So we'll see, and I hope that you will. This film will inspire some debate, and if you're not raising controversies, I'm sure that I will do it. So we'll see what happens and how that film appeals to you, and how you respond to it. So of the perfluorinated compounds, they chose not to deal with the PFASs in the movie because it's sort of a complex chemical issue because there's more than one perfluorinated compound. So they chose to focus only on mercury. But in the whale meat, there is a lot of perfluorinated compounds. So you could say mercury is a natural poison that has been there, you know, in the whale meat in the top of the food chain for ages. But this has worsened, and work done by Elsie Sunderland, who's part of our center, suggests that there's about 10 times as much mercury in the oceans as there used to be. The PFASs are different. They didn't used to be in the oceans. They are new. So the film essentially has two controversies. One is here you have these people who for centuries, essentially since the Viking Age, that population has lived on, you know, the sea, from the sea. And at times when there was no fish and there wasn't enough sheep, mutton to get, not enough birds in wintertime, for example, then they would live on whale meat. That was the way they survived. And whale meat is full of nutrients, vitamin D, and lots of other essential nutrients, and that was the way they survived. There's about, I think the best number is something like 800,000 pilot whales in the North Atlantic, and they take on average about 1,000 animals per year. So it's certainly sustainable. There is an island in the Caribbean called St. Vincent. Have you heard about that island? They take pilot whales too. And again, it's not as ancient a tradition as it is in the Faroes. But this tradition is now endangered. The birds are also full of pollutants, flame retardants, some mercury, a lot of PFASs, a lot of the perfluorinated compounds. So it's not just the pilot whale. The halibut, the other large fish are also contaminated. All of these perfluorinated compounds, they end up in the rivers, the Charles River or the Mississippi or whatever. So the pollution from, let's say, the 3M plant in Minnesota on the banks of the Mississippi River, that pollution ends up in the Caribbean and it comes out with the Gulf Stream up to the Faroes. So the PFASs and mercury are essentially very parallel situations. So that was one controversy. The other controversy, where you saw Pamela Anderson and a few other environmentalists complaining about killing whales, that is sort of a separate issue, and I'm glad that was covered too, because we all feel that whales are intelligent animals, but on the other hand, when you see how fast it happens, they cut both carotids. You have to cut on both sides because there won't be enough blood getting to the brain if you only cut on one side, because there's an exchange between the sides at the basis of the brain. But they also use that spear to cut the what do you call it? The spinal cord from the brain, and that's a recent addition to make death instant. But essentially, as soon as you cut the carotids on both sides, the whale will lose consciousness and it will die within, I guess, you'll see some movement, but the whale is not conscious anymore. So, I mean, that is, of course, still a controversy, but I think here we should focus on the pollution controversy. So let's discuss. David is
I just wanted to mention that it seems that they mentioned that the food chain supporting the fish in the wells and the seabirds they catch has changed. Of course, we have the same thing happening in the Gulf of Maine. And have they thought about whether this change in the food chain in the ocean affects the pollution, either the PFAS or the mercury?
We are affected by the marine pollution as well. It's in the food chains, and you could have eaten tuna fish safely in the past if we go several decades back. But we now have a situation where I, as a physician, would tell a pregnant woman, stay off tuna. And it's simply because the pollution is so intense. It has moved up the food chains that, yes, we should eat fish, especially pregnant women should have fish for dinner twice a week. That's the general advice from a nutritionist. But as an environmental epidemiologist, I would say, yes, but eat the right kinds of fish.
You'd probably be better off eating herring and sand eels.
Well, what should I answer? Where are the food chain people? Cindy, are you a food chain expert, or Clifton? You want to say something about the food chain?
Sure. So just for context, I work with Philippe with some data from the Faroe Islands, including the pilot whale and children data, PFAS data. But the pilot whale food web is actually interesting just because they eat a lot of squid. And so in some ways it's really simple in that way, but it really depends on the season, it depends on the year, and they've been shifting more away from squid actually for reasons we don't know and towards larger fish, which would only magnify the problem in that way. But
So the difference is that we can't tell the pilot whales to eat lower in the food chain like I tell the pregnant women. So the pilot whales are exposed to PFASs and to mercury and many other compounds simply as a result of our polluting the oceans. What are we doing time-wise? Because it's okay. So we have time for a few more questions. I think I'll turn to the trainees from STEEP and ask. Okay.
So I'm wondering around here on the Cape, you know, striper season, bluefish, where are they at with the PFAS, you know, contaminants, and as far as us eating them as a diet, you know, with the season here upon us now, we tend to, I know the tribal members, we eat a lot of herring. As soon as they start coming in, the herring alewife, and then that's usually the sign that the stripers and the blues come in. So we start, that's a large part of our diet, you know, for the warmer months while they're in season. So I'm just curious as to where they stand and should we be concerned?
I think there is information at the FDA website on PFASs in fish. Isn't that true? It is true that you can seek information. We're not looking at that specifically, but Rainer, do you want to comment on the food chain in regard to Massachusetts Bay or Narragansett or wherever you go looking for bluefish or striped bass? Certainly both bluefish and striped bass and swordfish and tuna, they are at the top of the food chain, and they will accumulate mercury and the PFASs. I know.
And the PCBs and everything else. Maybe for context, so I think the worst exposure will be drinking water if it's really high. If that is not an issue, then you have exposure in your house through things you use, be that, and you get through inhalation or through ingestion. And then there's the food question, and I think fish-wise, if it's an offshore fish, it'll be better because it'll have less than something that's coastal, just because most things still come through the rivers right now. And then if it's lower on the food chain, you'll be better off again. So the striper is probably worse than the herring. I think we should probably look into this for the region. We can try to do that in the next few years. I assume it is not yet a major problem, but as the health advisories for PFAS will change, that might change in the future. But I assume for now you're probably okay eating plenty of fish from the region as long as it's a little further offshore.
Okay, so I understand that there will be light refreshments coming. Oh, you have a question. I remember you. You were for our first meeting too. So you are Joyce Young. You're a physician.
Yeah, Dr. Joyce Young, naturopathic physician. I assume that the Faroe Islanders eat a fair amount of seaweed also. Is there an accumulation of PFAS in seaweed, algae?
The Faroese actually don't eat a whole lot of seaweed. That's more the Japanese. So, but you know, the seaweed will of course get a little bit of mercury and PFAS, but it's sort of the accumulation, the so-called biomagnification in the food chain. So the lower in the food chain you eat, if it's seaweed or if it's small shrimp or something, the better. So that's the principle. I understand that you have some calories sitting here in some little boxes that should be PFAS free and mercury free. Would you be willing to share some of them? And because I think everybody who participated here deserve something tasty and sweet and that we know is safe. And I understand that there are some snacks coming up and beverages, so that we could look at the posters as well. Anyway, did you want to say something? All right. Okay.
So are there any other questions for Philippe? Michael, do you want to ask a quick question? Or, there's one over. Could you talk into the microphone? Thanks.
I was just wondering what the message of the movie was. Are they just trying to depict, life in the Faroe Islands, or are they trying to, persuade the public one way or the other that hunting whales should or shouldn't be a practice? Or is that up to audience interpretation?
Well, the Faroese have existed as a nation. That's what they call themselves for hundreds and hundreds of years. They became part of the Danish kingdom way back in the medieval times. But they have maintained their own language, their own culture, their own way of life. And they believe that the way the world is going, they are threatened. So their health is threatened from PFAS and mercury, and their culture is threatened because whether you are Pamela Anderson or whoever who's criticizing them, the oceans are so polluted that they feel that it's unjust. It's perhaps even unethical that somebody else is taking advantage and dumping PFAS in the oceans along with other poisons, and then, hey, they never produced one grain of mercury or PFAS or anything, but they come to the Faroes through the Gulf Stream that essentially comes from America, and so there you have it, and they're trying to figure out, are we going to maintain our identity, and how are we going? And you saw the fisherman and his wife, the nurse. that they had their own sort of controversies and discussions. How are we going to respond to this? Do we care for our kids? Their immune system is endangered by PFASs. Their brains may not develop optimally. Do we care? And how are we going to respond to that? So I don't know what the answer is, but
Is the filmmaker Faroese? Like, who's the intended audience of the movie? Okay, so, but is it for the Faroese people, or is like, I'm just wondering.
I don't know the answer to that.
I think the film doesn't give us any answers. I think the film was created to generate discussions like we've had here with questions of various kinds. I think it has been made to sensitize ourselves to mercury, but in parallel also to PFAS, the perfluorinated compounds. In some parts of the world, the exposure comes from contaminated drinking water. In other parts of the world, it comes from air pollution, it comes from products of various kinds. There's not a single American today who doesn't have PFASs in their bodies. Nobody invited those compounds. Nobody was actually asked if they would approve of this kind of contamination. We all got it. And the next generation gets it because it passes through the placenta into the fetal circulation. The next generation will get it from breastfeeding because it comes out into human milk. Nobody asked the next generation. They were born with this. And so, anyway, and this is going to continue unless we try to do the hardest we can to stop this kind of behavior that affects the Faroese. It affects people in the Caribbean. It affects people all over the world. And I think this is the kind of issues that are highly relevant to the filmmaker and to his, I guess, thinking and his purpose of spending 5 years making this film.
Just one quick question and then we'll wrap up.
I guess just adding to that previous question, in terms of the epidemiological investigation, has that led to behavior changes? Is there more acceptance now? And how widely, how much of the population participated?
As part of STEEP, we have a study ongoing of kids whom we have followed since they were born, actually before they were born. We have something like 80% of the kids participating, so there's a lot of support. But, and Paul, my colleague, said in the film that whale meat is not suited for human diet. And so he has essentially recommended to the Faroese, and not necessarily to stop the whaling, because that's a cultural issue, but to stop eating the meat. And as you could see, people eat it because it's tradition, it's part of their identity. And so they are taking a risk. But I think with time, it's going to be less and less. That's my guess.
Let's thank Philippe for his thoughts on the film. He'll be around all afternoon. So we're going to take a break now. We have some lunch in the Selectmen's Conference Room, which is just through that door. So please help yourself to some snacks. Again, all the STEEP team members are wearing these blue shirts, so you can find us. So please feel free to ask questions. The students and postdoctoral trainees will be by their posters, so feel free to look at their work. And we'll reassemble here a little bit before 12:30 for our STEEP project updates. Thank you.